Hi. I'm robo-Suzie and today I'll talk to you about tips for varicose veins during pregnancy. Also don't forget to check out the link below, to find out how I got rid of varicose veins fast and easy. I didn't believe it at first. But back to our topic. Varicose veins are blood vessels just beneath the skin that have widened and twisted due to a defect in the valves, within the veins themselves. Blood pools in sections of the vein, causing the vein to bulge and swell. Varicose veins usually occur in the legs and feet. However, they can occur in other parts of the body also, such as the veins in the lower end of the esophagus, the lining of the stomach, the colon, the rectum and the scrotum. Usually there are no symptoms, but in some cases they result in serious medical problems. Varicose veins cause some discomfort, but for many people, this condition reflects a problem basically in terms of appearance, since the veins look ropey and twisted and may bulge out beneath the skin. The condition of varicose veins is very common during pregnancy. In fact, it has been estimated that as many as 40% of all pregnant women suffer from varicose veins. There are many reasons for the development of varicose veins during pregnancy. The principal cause is the hormonal changes that occur during pregnancy. Increased levels of the hormone, progesterone, cause blood vessels to relax. This may allow the two halves of the valves in the vein to separate slightly, thus disrupting their function of preventing the backflow of blood. Secondly, the growing uterus puts pressure on the pelvic veins and on the inferior vena cava. This increases blood pressure in the leg veins, which then tend to be prone to varicose. With the growth of the baby, the uterus enlarges and the veins become even more prominent. Hereditary factors also influence the condition. A family history of varicose veins leads to a greater possibility of contracting the condition. Lastly, women with excessive weight show a higher incidence of varicose veins. Varicose veins may itch or even hurt, but the biggest problem women face comes as an effect on one's vanity. During pregnancy, varicose veins called hemorrhoids can also form in the vagina or around the anus. Serious issues could arise on formation of blood clots in the veins that in turn may cause chronic circulatory problems. A rapid heartbeat or shortness of breath could be signs of a pulmonary embolism, which requires immediate medical attention. The best way to minimize varicose veins is to avoid putting too much pressure on the legs during pregnancy. Daily exercise in the form of a small distance brisk walk can help. Pregnant women should avoid standing for long hours and elevate their feet and legs, whenever possible. One should try to sleep on the left side with feet on a pillow. Since the inferior vena cava is on the right side, left side rest relieves it of the weight of the uterus, thus decreasing venous pressure in the lower extremities. Wearing the special support tights just before getting out of bed proves to be healthy. Taking this precaution before standing prevents excess blood from gathering in the legs. One should avoid crossing of legs while sitting. Finally, a check on body weight is very important, as it can aggravate the situation further. Varicose veins that develop during pregnancy usually subside on their own within 3 or 4 months of delivery. If the bulging veins become too uncomfortable to live with, one can seek medical help. Varicose veins can be corrected surgically. However, before deciding on surgery, it is vital to comprehend that unfortunately, varicose veins are likely to recur in each succeeding pregnancy, often sooner than during the previous pregnancy. Also, varicose veins may become increasingly prominent with each succeeding pregnancy. Therefore, it is advisable to undertake the surgery only after planning one's family completely. That's it. Thank you. Please subscribe, comment and like this video if it was helpful. See you soon.